Welcome to our YouTube video on healthcare support worker interview questions and answers. Whether you're preparing for an upcoming interview or simply looking to enhance your understanding of the role, you've come to the right place. In this video, we'll dive into a comprehensive guide featuring common interview questions you may encounter when applying for a healthcare support worker position within the NHS or care home. Throughout the video, we'll not only provide you with sample questions, but also offer detailed responses using the STAR approach: situation, task, action, and result. This method will help you structure your answers effectively, showcasing your skills and experiences with clarity and confidence. By the end of this video, you'll have a solid understanding of how to approach various interview scenarios, demonstrating your suitability for the role of a healthcare support worker. So, without further ado, let's get started and ace that interview. 1. Can you tell us about yourself and your background? I have a background in healthcare with over 5 years of experience as a healthcare support worker. I hold a diploma in health and social care and have completed various training programs on patient care, infection control, and safeguarding. My previous roles involved supporting patients with daily living activities, assisting with mobility, and maintaining accurate patient records. I am passionate about providing compassionate, patient-centered care, and am dedicated to upholding the values of the NHS. In my previous position at Tit Hospital, I consistently received positive feedback for my empathetic approach and teamwork skills. 2. Why do you want to work as a healthcare support worker? I want to work as a healthcare support worker because I am passionate about helping others and making a positive impact on patients' lives. I am deeply motivated by the opportunity to support individuals during their most vulnerable times, ensuring they receive the care and compassion they deserve. Additionally, I am drawn to the NHS values of patient-centered care, respect, and excellence, and I am eager to contribute to a team that shares these principles. I believe this role will allow me to utilize my interpersonal skills and empathy, while offering opportunities for personal and professional growth in a rewarding healthcare environment. 3. What do you know about the NHS England and its values? The NHS England, established in 1948, is the publicly funded healthcare system in England. It provides comprehensive healthcare services to all residents, free at the point of use, funded primarily through taxation. The core values of the NHS are outlined in the NHS Constitution, which include respect and dignity, treating every individual with respect and valuing their dignity, commitment to quality of care, striving for excellence and professionalism in providing high-quality care, compassion, ensuring care is delivered with kindness and empathy, improving lives, aiming to improve health and well-being by providing effective and personalized care, working together for patients, collaborating with patients, families, and other organizations to deliver the best possible care. Everyone counts, ensuring equity, inclusivity, and non-discrimination in providing healthcare services. The NHS England is a comprehensive, publicly funded healthcare system that operates on principles of respect, quality, compassion, continuous improvement, collaboration, and inclusivity. These values guide the delivery of healthcare services to ensure every patient receives high-quality, respectful, and equitable care. 4. How do you ensure patient confidentiality? To ensure patient confidentiality, I strictly adhere to privacy policies and guidelines set by the healthcare facility and the NHS. This involves never discussing patient information in public areas, securing patient records in locked or password-protected systems, and only accessing patient information necessary for my duties. Additionally, I am vigilant about who can overhear conversations and always verify the identity of individuals requesting patient information. I ensure patient confidentiality by following strict privacy protocols, securing records, limiting information access, and being mindful of conversations. 5. Describe a time when you worked as part of a team. During my previous job as a healthcare support worker, I worked as part of a multidisciplinary team to care for a patient with complex needs. The patient required assistance from nurses, physiotherapists, and occupational therapists. One day, we had a particularly challenging situation where the patient's condition suddenly worsened. As a team, we quickly communicated and coordinated our actions. I assisted the nurses in monitoring vital signs, supported the physiotherapists in repositioning the patient to ensure comfort, and helped the occupational therapists with necessary adjustments in the patient's environment. By working together and effectively communicating, we stabilized the patient and provided the necessary care efficiently. I worked as part of a multidisciplinary team to stabilize a patient with complex needs by effectively communicating and coordinating actions, ensuring the patient's well-being and efficient care delivery. 6. How do you handle stressful situations? Handling stressful situations requires a combination of effective time management, clear communication, and self-care strategies. When faced with stress, I prioritize tasks to ensure urgent matters are addressed promptly. I communicate openly with colleagues to delegate tasks and seek support when needed. Additionally, I practice mindfulness techniques, such as deep breathing and taking short breaks, to maintain calm and focus. Regular reflection on challenging situations helps me learn and improve my coping mechanisms for future instances. In summary, I manage stressful situations through prioritization, teamwork, and mindfulness, ensuring both patient care and my well-being are maintained. 7. Can you give an example of a time when you provided excellent patient care? During my previous role as a healthcare support worker, I was assigned to care for an elderly patient recovering from hip surgery. The patient was anxious and in considerable pain, which affected her mood and willingness to participate in rehabilitation activities. Recognizing the importance of both physical and emotional support, I took extra time to engage her in conversation, listen to her concerns, and provide reassurance. I coordinated closely with the physiotherapy team to ensure her rehabilitation plan was adhered to, while also making small adjustments to her daily routine to increase her comfort. For instance, I helped her with gentle exercises, ensured she had access to her favorite books, and facilitated video calls with her family, which greatly lifted her spirits. By the end of her stay, she expressed deep gratitude for the care and attention she received, and her recovery progressed more smoothly than anticipated.
Before we proceed further in this video, I kindly request just 1 minute of your time to introduce our books currently available for purchase on Amazon.com. We currently have 2 books on sale. The first book is titled Discover Abroad: Navigating Travel, Immigration, Study, and Employment Opportunities Abroad. Our second book is titled 450 Business Analyst Interview Questions and Answers, Ace Your Interview. These books are designed to help you expand your horizons, embrace new experiences, and unlock a world of possibilities. Additionally, the interview book can assist you in standing out from the competition and landing your dream job abroad. Simply click on the link provided in the description box of this video to order yours now.
8. How do you prioritize your tasks during a busy shift? During a busy shift, prioritizing tasks involves assessing the urgency and importance of each task, beginning with any immediate patient needs, such as administering medications or attending to emergencies. Routine tasks like vital signs and hygiene care are planned around these priorities. Communication with team members is essential to ensure all critical tasks are covered. I also stay organized by keeping a checklist and adjusting as new tasks arise. Effective prioritization means balancing patient care with efficiency, ensuring no critical needs are overlooked while maintaining a structured approach to the shift's duties. To prioritize tasks during a busy shift, I assess the urgency of tasks, address immediate patient needs first, plan routine tasks around these, maintain communication with the team, and use a checklist to stay organized and adaptable. 9. How would you handle a difficult patient? Handling a difficult patient requires patience, empathy, and effective communication. First, I would remain calm and composed, acknowledging their feelings and concerns. Listening actively to understand the root of their frustration is crucial. I would ensure they feel heard and respected, addressing their concerns with clear and concise information. If necessary, I would involve other team members or escalate the issue to a supervisor for additional support. Maintaining a compassionate and professional demeanor throughout the interaction is essential to de-escalate the situation and provide the best care possible. 10. What do you understand by person-centered care? Person-centered care is an approach that prioritizes the individual needs, preferences, and values of patients. It involves recognizing patients as unique individuals with their own backgrounds, beliefs, and goals, and tailoring care plans accordingly. This approach emphasizes collaboration between healthcare professionals and patients, ensuring that patients are actively involved in decisions about their care. Person-centered care also focuses on treating patients with empathy, respect, and dignity, while considering their physical, emotional, and social well-being. 11. How do you maintain accurate patient records? Maintaining accurate patient records is crucial for providing high-quality healthcare. To ensure accuracy, I follow established protocols and guidelines provided by my institution. This involves documenting all relevant information promptly and comprehensively, including patient demographics, medical history, treatment plans, and progress notes. I prioritize attention to detail, double-checking entries for completeness and correctness. Additionally, I ensure confidentiality by adhering to regulations and only accessing patient records on a need-to-know basis. Regular training and staying updated on any changes in record-keeping practices help me maintain proficiency in this aspect of my role. Overall, my goal is to contribute to efficient and effective patient care by ensuring that their records are accurate and up to date. 12. Describe a time when you went above and beyond for a patient. There was a time when a patient under my care was particularly anxious about an upcoming medical procedure. Understanding the importance of emotional support in healthcare, I took the initiative to sit down with the patient, patiently listened to their concerns, and provided reassurance. I spent extra time explaining the procedure in detail, addressing their questions and fears with empathy and understanding. Additionally, I ensured that the patient felt comfortable and supported throughout the entire process, even staying by their side during the procedure itself. This extra effort helped alleviate the patient's anxiety and contributed to a smoother experience overall. 13. How do you ensure infection control in your work? Infection control is paramount in healthcare settings to safeguard patients, staff, and visitors. My approach centers on strict adherence to established protocols and guidelines. I maintain meticulous hand hygiene, washing with soap and water, or using hand sanitizer frequently, especially before and after patient contact. I also rigorously follow proper techniques for donning and doffing personal protective equipment (PPE) to prevent cross-contamination. Additionally, I am vigilant about environmental cleanliness, regularly disinfecting surfaces and equipment. Lastly, I stay updated on the latest infection control practices and participate in ongoing training to enhance my knowledge and skills in this area. 14. Can you explain the importance of safeguarding in healthcare? Safeguarding in healthcare is paramount as it ensures the protection of vulnerable individuals from harm, abuse, or neglect. As a healthcare support worker, you play a crucial role in identifying signs of abuse or neglect among patients and taking appropriate action to prevent further harm. This might involve reporting concerns to relevant authorities, providing emotional support to affected individuals, and implementing safeguarding protocols within healthcare settings. Ultimately, safeguarding promotes the well-being and safety of patients, fostering an environment of trust and care within healthcare facilities. 15. How do you handle feedback and criticism? When handling feedback and criticism, I believe in maintaining a positive and open mindset. I welcome feedback as an opportunity for growth and improvement, recognizing that it helps me become better at my job. I actively listen to feedback, ensuring I understand the perspective being shared. Rather than taking criticism personally, I view it as valuable insight that can help me refine my skills and approach. I remain calm and composed, focusing on constructive solutions rather than dwelling on the criticism itself. In past experiences, I've used feedback to adjust my practices, improve my performance, and deliver better outcomes for those under my care. Overall, my approach to feedback is centered on continuous learning and professional development, which ultimately benefits both myself and the individuals I support. 16. What strategies do you use to communicate effectively with patients? Effective communication with patients involves several strategies. Firstly, active listening is crucial. It ensures patients feel heard and understood. Using clear, simple language avoids misunderstandings, especially when explaining medical terms. Nonverbal cues, like maintaining eye contact and using open body language, help build trust and show empathy. Asking open-ended questions encourages patients to share more about their concerns and needs. Additionally, being patient and giving patients time to express themselves without rushing them is important. Regularly checking for understanding by summarizing and reflecting back what the patient has said ensures clarity. Lastly, being culturally sensitive and aware of language barriers is essential, sometimes requiring the use of translation services or other aids. 17. How do you support patients' physical and emotional needs? Supporting patients' physical and emotional needs involves a comprehensive approach. For physical needs, I ensure that patients receive proper hygiene, nutrition, and mobility assistance. This includes helping with bathing, feeding, and moving around safely. I also monitor vital signs and report any changes to the healthcare team. For emotional needs, I provide a compassionate and listening ear, offer comfort, and create a supportive environment. I encourage patients to express their feelings and concerns, provide reassurance, and involve them in decision-making about their care to foster a sense of control and dignity. 18. Describe a time when you had to manage a challenging situation with a colleague. In a previous role, I encountered a challenging situation with a colleague who was consistently not following proper hygiene protocols, which is crucial in a healthcare setting. This behavior was concerning as it could affect patient safety. I decided to address the issue professionally and constructively. First, I approached the colleague privately and expressed my concerns in a respectful manner, focusing on the importance of maintaining hygiene standards for patient care rather than personal criticism. Despite my approach, the issue persisted, so I escalated the matter to our supervisor, providing specific examples and suggesting potential solutions, such as additional training. Our supervisor arranged a meeting where the team could discuss the protocols and reinforce their importance. As a result, the colleague became more conscientious about their practices. This experience taught me the importance of addressing issues directly and professionally while seeking appropriate support when needed. By handling the situation calmly and constructively, we ensured a safer environment for our patients. 19. How do you stay updated with healthcare practices and policies? I stay updated with healthcare practices and policies through a combination of continuous education, professional networking, and regular consultation of reliable sources. I regularly participate in workshops, training sessions, and seminars relevant to my role. Additionally, I am a member of professional organizations and online communities where current issues and advancements are frequently discussed. I also subscribe to reputable healthcare journals and newsletters to keep abreast of the latest developments. Furthermore, I ensure to review updates from regulatory bodies and healthcare institutions to remain compliant with new guidelines and protocols. 20. Can you describe a situation where you had to handle an emergency? In my previous role as a healthcare support worker, encountered an emergency involving a patient who suddenly experienced severe chest pain and shortness of breath. Recognizing the symptoms of a potential heart attack, I immediately alerted the nursing staff and called for emergency medical assistance. While waiting for the response team, I remained calm and followed protocol by keeping the patient comfortable, monitoring their vital signs, and reassuring them to reduce anxiety. Once the emergency team arrived, I provided them with a detailed report of the patient's condition and the actions taken. The patient was swiftly transferred to the emergency department for further treatment, and I later followed up to ensure they received appropriate care. This experience highlighted the importance of quick thinking, effective communication, and staying composed under pressure. 21. How do you ensure patient dignity and respect in your care? Ensuring patient dignity and respect in care is paramount. It starts with acknowledging the patient as an individual with unique needs, preferences, and rights. One way to uphold dignity and respect is by maintaining privacy during care activities, such as closing curtains or doors when providing personal care, using appropriate language and tone when speaking with patients, addressing them respectfully by their preferred name or title, also contributes to maintaining their dignity. Listening attentively to their concerns, preferences, and wishes demonstrates respect for their autonomy and values. Additionally, involving patients in decision-making regarding their care empowers them and honors their autonomy. Lastly, being mindful of cultural, religious, and personal beliefs ensures that care practices align with the patient's values, further preserving their dignity. 22. How do you handle a situation where you witness poor practice or negligence? When witnessing poor practice or negligence, I take immediate and appropriate action to ensure patient safety. First, I assess the situation to determine if there's any immediate danger to the patient. If so, I intervene directly to mitigate harm. I then report the incident to a supervisor or manager as per the organization's protocols. Documentation of the incident is also crucial, so I ensure that I record all relevant details accurately. Additionally, I reflect on the situation to understand how it occurred and how similar incidents can be prevented in the future, often discussing with colleagues to promote better practices. 23. Describe your experience with taking and recording vital signs. In my previous role as a healthcare support worker, I was responsible for taking and recording vital signs regularly. This included measuring blood pressure, heart rate, respiratory rate, and temperature. I ensured that I used the correct techniques and equipment for accurate readings, such as using a properly calibrated blood pressure cuff and ensuring the patient was at rest. I also maintained meticulous records of these vital signs, entering the data into patient charts promptly and accurately. This information was critical for monitoring patients' health and assisting the medical team in making informed decisions about their care. Through my experience, I became proficient in performing these tasks efficiently and with attention to detail. Understanding the importance of accurate documentation for patient safety and care quality. 24. How do you assist patients with their daily living activities? I assist patients with their daily living activities by first understanding their individual needs and capabilities through careful assessment and communication. I provide support in activities such as bathing, dressing, grooming, and eating, ensuring that each task is performed safely and respectfully. I also help with mobility, including transferring patients from beds to wheelchairs and aiding with walking. Additionally, I offer emotional support and companionship, which is crucial for the overall well-being of the patients. My approach is patient-centered, aiming to promote independence as much as possible while ensuring comfort and dignity. 25. How would you approach a situation where a patient refuses treatment? Approaching a situation where a patient refuses treatment requires empathy, patience, and effective communication skills. Firstly, I would respectfully listen to the patient's concerns and reasons for refusing treatment, acknowledging their autonomy and right to make decisions about their own care. Building trust and rapport is crucial in such situations, so I would strive to establish a supportive and non-judgmental environment. Next, I would calmly explain the potential risks and benefits of the recommended treatment, addressing any misconceptions or fears the patient may have. Providing clear and understandable information can help the patient make an informed decision about their care. If the patient still refuses treatment despite discussion and education, I would involve other members of the healthcare team, such as nurses or physicians, to explore alternative options and possibly seek a second opinion. It's essential to respect the patient's autonomy while also ensuring their safety and well-being. 26. Can you explain your understanding of confidentiality and data protection? Confidentiality and data protection are foundational principles in healthcare that I take very seriously. Confidentiality means that any information shared by patients or obtained during the course of providing care must be kept private and not disclosed to unauthorized individuals. This includes personal information, medical history, treatment plans, and any other sensitive data. It's crucial to maintain confidentiality to build trust with patients and protect their privacy rights. Data protection involves safeguarding this confidential information from unauthorized access, use, or disclosure. This includes following organizational policies and procedures for handling patient data securely, such as using encrypted communication channels, password, and restricting access to patient records only to authorized personnel. It also involves being aware of and complying with relevant laws and regulations, such as the General Data Protection Regulation (GDPR) in Europe or the Health Insurance Portability and Accountability Act (HIPAA) in the United States. 27. How do you ensure effective communication with other healthcare professionals? Effective communication with other healthcare professionals is vital for providing quality patient care. I ensure this by maintaining open lines of communication through active listening, clear verbal communication, and concise documentation. I actively engage in team meetings and interdisciplinary rounds to share pertinent information and collaborate on patient care plans. Additionally, I am responsive to messages and emails, ensuring timely communication. I also respect the expertise of other healthcare professionals, seeking clarification when needed and offering my insights when appropriate to ensure a holistic approach to patient care. 28. Describe a time when you had to handle multiple tasks at once. In a previous position as a healthcare support worker, I often found myself managing multiple tasks simultaneously. One notable instance was during a particularly busy shift where several patients required immediate assistance, while I was also responsible for restocking supplies and assisting other staff members. To effectively handle the situation, I prioritized tasks based on urgency and importance. I delegated non-urgent tasks to colleagues when possible, while I focused on attending to patients in critical need first. I remained organized by utilizing lists and checklists to keep track of tasks and ensure nothing was overlooked. Despite the hectic environment, I maintained a calm and composed demeanor, which helped me navigate through the tasks efficiently. By effectively managing multiple responsibilities, I ensured that all patients received the care they needed while also fulfilling other duties required for smooth operations. 29. How do you deal with patients or family members who are upset or angry? When faced with upset or angry patients or family members, I approach the situation with empathy, patience, and professionalism. I start by actively listening to their concerns and acknowledging their emotions, validating their feelings without judgment. I strive to understand the root cause of their distress and reassure them that their concerns are being heard and taken seriously. I remain calm and composed, maintaining a respectful and non-confrontational demeanor throughout the interaction. Depending on the situation, I may offer solutions or involve appropriate personnel, such as a supervisor or healthcare provider, to address the issue effectively. Above all, I prioritize de-escalation and strive to reach a resolution that satisfies the patient or family member while upholding the standards of care and professionalism. 30. What would you do if you noticed a colleague not following proper hygiene protocols? If I noticed a colleague not following proper hygiene protocols, my approach would prioritize patient safety and professionalism. Firstly, I would address the situation discreetly and directly with the colleague, emphasizing the importance of adhering to hygiene protocols for the well-being of both patients and staff. I would offer support and assistance if the colleague needs clarification or additional training on proper procedures. If the issue persists or if the colleague seems resistant to feedback, I would escalate the matter to a supervisor or manager while maintaining confidentiality and professionalism. It's crucial to handle such situations with sensitivity and respect, focusing on corrective action rather than blame. 31. How do you keep yourself motivated in a demanding job? In a demanding job like healthcare support, maintaining motivation is crucial for providing high-quality care consistently. Personally, I find motivation in the meaningful impact I can make in patients' lives every day. Knowing that my work directly contributes to improving someone's health and well-being gives me a sense of purpose and fulfillment. Additionally, setting realistic goals for myself and celebrating small achievements along the way helps me stay motivated. I also prioritize self-care by taking breaks when needed, engaging in activities outside of work that I enjoy, and seeking support from colleagues or supervisors when feeling overwhelmed. Lastly, staying updated with new developments in healthcare, attending training sessions, and seeking opportunities for professional growth keeps me engaged and motivated to continuously improve in my role. 32. Describe your experience with administering medication under supervision. In my experience, administering medication under supervision has been a key aspect of my role as a healthcare support worker. I follow strict protocols and guidelines to ensure accuracy and safety in medication administration. This includes verifying patient information, checking medication labels against prescriptions, and confirming dosage requirements. I also prioritize patient education, ensuring they understand their medications and any potential side effects. Throughout the process, I maintain clear communication with supervising healthcare professionals, reporting any concerns or observations promptly. My goal is to ensure that medication administration is conducted efficiently, accurately, and with the utmost regard for patient safety. 33. How do you support patients with mobility issues? Supporting patients with mobility issues requires empathy, patience, and specialized skills. In my role as a healthcare support worker, I have experience assisting patients with various mobility challenges. One approach I use is to assess each patient's individual needs and capabilities to determine the level of assistance required. This may involve helping patients with activities such as transferring from bed to chair, walking, or using mobility aids like walkers or wheelchairs. I prioritize patient safety by ensuring proper body mechanics and using appropriate assistive devices. Communication is also crucial. I engage with patients to understand their preferences and provide encouragement and emotional support throughout the process. Additionally, I collaborate with other healthcare professionals, such as physical therapists, to develop personalized care plans that promote mobility and independence. Overall, my goal is to empower patients with mobility issues to navigate their environment comfortably and confidently. 34. What steps do you take to manage your time effectively? To manage my time effectively, I employ several strategies that allow me to prioritize tasks, maintain productivity, and ensure quality care for patients. Firstly, I begin each day by creating a detailed schedule or to-do list, outlining all the tasks that need to be completed and allocating specific time slots for each task based on their urgency and importance. Additionally, I utilize time management tools such as calendars, planners, or digital apps to help me stay organized and on track. Moreover, I regularly reassess my workload throughout the day, adjusting my schedule as needed to accommodate unexpected tasks or emergencies. I also practice delegation when appropriate, involving other team members to share responsibilities and optimize efficiency. Furthermore, I strive to minimize distractions and interruptions during work hours, focusing my attention on the task at hand to maximize productivity. 35. Can you provide an example of how you handled a cultural or language barrier with a patient? In one instance, I encountered a language barrier while caring for a patient who primarily spoke a language I wasn't fluent in. Recognizing the importance of effective communication in providing quality care, I took several steps to bridge the gap. Firstly, I utilized available resources such as interpreter services or bilingual staff members to facilitate communication between myself and the patient. I also made use of non-verbal communication techniques such as gestures and visual aids to convey important information and ensure the patient understood their care plan. Additionally, I took the time to learn some basic phrases and greetings in the patient's language, which helped to build rapport and demonstrate respect for their culture. By showing empathy, patience, and a willingness to adapt to the patient's needs, I was able to overcome the language barrier and provide the patient with the support and care they required. 36. How do you ensure patients' nutritional needs are met? Ensuring patients' nutritional needs are met is a fundamental aspect of healthcare support. I approach this by first assessing each patient's dietary requirements, considering factors like age, medical condition, dietary restrictions, and personal preferences. This assessment helps me develop individualized meal plans in collaboration with the healthcare team. Monitoring patients' food intake is essential to ensure they are receiving adequate nutrition. I observe their dietary habits during meals and offer assistance with feeding if necessary. Additionally, I encourage patients to eat balanced meals and snacks, providing guidance on food choices and portion sizes. Education is key in promoting healthy eating habits. I take the time to educate patients and their families about the importance of nutrition and how it supports their overall health and well-being. This includes explaining the benefits of a balanced diet and addressing any concerns or questions they may have. Regular communication with the healthcare team allows for any adjustments to be made to a patient's meal plan based on their changing nutritional needs. By working collaboratively and staying attentive to each patient's dietary requirements, I ensure they receive the necessary nutrition to support their recovery and overall health. 37. Describe a time when you had to adapt to a sudden change in the workplace. In a previous role, there was a sudden influx of patients due to unforeseen circumstances, which required immediate adaptation from the entire healthcare team. Despite the unexpected surge in workload, I remained calm and focused on addressing the needs of the patients. I quickly adjusted my priorities, reallocating resources to ensure efficient patient care delivery. This involved working closely with my colleagues to delegate tasks effectively and streamline processes. Despite the challenges posed by the sudden change, I maintained a positive attitude and encouraged teamwork to overcome obstacles. Through effective communication and collaboration, we were able to successfully manage the situation and provide quality care to all patients. 38. How do you support patients with mental health issues? Supporting patients with mental health issues requires a compassionate and holistic approach. In my role as a healthcare support worker, I prioritize building trusting relationships with patients to create a safe and supportive environment. I actively listen to their concerns, validating their experiences and emotions without judgment. I educate myself on various mental health conditions to better understand the challenges patients may face and tailor my approach accordingly. I promote self-care strategies and coping mechanisms, encouraging patients to engage in activities they enjoy and practice relaxation techniques. Collaboration with other members of the healthcare team, such as psychologists or social workers, is crucial to developing comprehensive care plans that address patients' mental health needs. Additionally, I advocate for patients' rights and ensure they have access to appropriate resources and support networks. Overall, my goal is to empower patients with mental health issues to lead fulfilling lives and navigate their journey towards recovery with dignity and respect. 39. How do you document and report any concerns about patient welfare? Documenting and reporting concerns about patient welfare is a crucial aspect of my role as a healthcare support worker, and I follow established protocols to ensure thorough and accurate documentation. When I encounter a concern, whether it's related to a patient's physical condition, emotional well-being, or any other aspect of their care, I immediately document the details in the patient's medical records or incident report forms, depending on the severity and nature of the concern. I ensure that my documentation is clear, concise, and objective, including relevant information such as the date, time, nature of the concern, any observed symptoms or behaviors, and any actions taken. If necessary, I also communicate the concern verbally to the appropriate healthcare professionals, such as nurses or supervisors, to ensure timely attention and follow-up. 40. Describe your approach to working with elderly patients. When working with elderly patients, my approach is centered on compassion, respect, and personalized care. I recognize that each individual has unique needs, preferences, and life experiences. So I strive to build trusting relationships by taking the time to listen attentively and understand their concerns. Patience is key, especially when assisting with activities of daily living or addressing health-related issues. I aim to empower elderly patients by involving them in decision-making processes regarding their care whenever possible, fostering a sense of autonomy and dignity. Furthermore, I prioritize safety and comfort, adapting my communication style and pace to suit the patient's abilities and preferences. Whether it's providing assistance with mobility, medication management, or simply offering companionship, I approach each interaction with empathy and sensitivity. 41. How do you handle confidential information in a shared work environment? In a shared work environment, handling confidential information requires strict adherence to privacy protocols and ethical standards. I ensure confidentiality by first understanding the sensitivity of the information I handle, whether it's patient records, medical histories, or personal details. I only access this information on a need-to-know basis, limiting its exposure to authorized personnel. To further safeguard confidential information, I utilize secure communication channels and password-protected systems when transmitting or storing data. Physical documents containing sensitive information are stored securely and accessed only by authorized individuals. When discussing patient-related matters, I do so in private, ensuring that conversations cannot be overheard by unauthorized persons. I'm vigilant about maintaining confidentiality even in casual conversations, refraining from discussing patient information in public areas where others may overhear. Additionally, I adhere to organizational policies and legal regulations, such as HIPAA in the United States or GDPR in Europe, to ensure compliance with data protection laws. If I ever encounter a breach of confidentiality or unauthorized access to sensitive information, I promptly report it to the appropriate authorities and take necessary steps to mitigate any potential harm. By prioritizing confidentiality and following established protocols, I uphold patient trust and maintain the integrity of the healthcare institution. 42. What would you do if a patient or family member made a complaint? If a patient or family member made a complaint, my immediate response would be to listen attentively and empathetically to their concerns. I would reassure them that their complaint is being taken seriously and that I am committed to addressing it promptly. I would then take steps to resolve the issue, which may include escalating the complaint to the appropriate supervisor or manager, documenting the details of the complaint accurately, and initiating an investigation if necessary. Throughout the process, I would maintain open communication with the patient or family member, keeping them informed of any progress or resolutions. Additionally, I would reflect on the complaint to identify any areas for improvement in our service delivery and take proactive measures to prevent similar issues from arising in the future. 43. How do you manage your own stress and well-being in this role? Managing stress and maintaining my well-being in this role is essential for providing effective care to patients. I prioritize self-care through various strategies to manage stress effectively. Firstly, I maintain a healthy work-life balance by setting boundaries between work and personal life, ensuring that I have time for rest, relaxation, and activities that I enjoy outside of work. Additionally, I engage in stress-reducing activities such as exercise, meditation, or hobbies that help me unwind and recharge. I also make sure to stay connected with friends, family, and colleagues for emotional support and social interaction. Furthermore, I recognize the importance of seeking support when needed, whether it's through counseling, peer support groups, or employee assistance programs. Moreover, I practice mindfulness and self-awareness, regularly checking in with myself to monitor my stress levels and emotions. If I notice signs of burnout or overwhelming stress, I take proactive steps to address it, such as taking breaks, seeking support, or adjusting my workload if possible. 44. Describe your experience with assisting in patient assessments. Assisting in patient assessments is a fundamental aspect of my role as a healthcare support worker, and I've gained valuable experience in this area throughout my career. In these assessments, I collaborate closely with nursing staff and other healthcare professionals to gather and document vital information about the patient's health status, including their physical, emotional, and social well-being. My experience involves conducting basic assessments such as measuring vital signs, documenting patient history, and assisting with mobility and activities of daily living. I also play a key role in observing and reporting any changes in the patient's condition to the nursing team, ensuring timely intervention and appropriate care. Throughout these assessments, I prioritize patient-centered care, maintaining a compassionate and respectful approach to ensure the patient feels comfortable and supported. I understand the importance of thorough documentation and clear communication with the healthcare team to facilitate continuity of care and promote positive patient outcomes. 45. How do you ensure patients are comfortable and at ease during their stay? Ensuring patients are comfortable and at ease during their stay is a priority for me as a healthcare support worker. I accomplish this through various means, starting with attentive listening and understanding of their needs and concerns. Creating a welcoming and supportive environment is essential, so I greet patients warmly, introduce myself, and explain what they can expect during their stay. Regular communication is key to addressing any questions or anxieties they may have, so I make myself readily available and encourage open dialogue. Additionally, I strive to anticipate their needs by providing timely assistance with activities of daily living, medication management, and pain relief. Beyond physical comfort, I also recognize the importance of emotional support. I offer empathy, encouragement, and reassurance, and I take the time to engage in conversation and build rapport. Small gestures such as providing a comforting presence, offering a listening ear, or arranging visits from loved ones can make a significant difference in the patient's experience. 46. What do you understand about the role of a healthcare support worker in end-of-life care? In end-of-life care, healthcare support workers play a crucial role in providing comfort, dignity, and support to patients and their families during the final stages of life. As a healthcare support worker in end-of-life care, I understand that my role encompasses various responsibilities. First and foremost, I provide compassionate and empathetic care to patients, focusing on alleviating their physical discomfort and pain. This involves assisting with activities of daily living, such as bathing, grooming, and feeding, while maintaining their dignity and respecting their autonomy. Additionally, I offer emotional support to both patients and their families, helping them navigate the complex emotions and challenges associated with end-of-life care. I listen attentively to their concerns, provide reassurance, and offer a comforting presence during this difficult time. Communication is essential in end-of-life care, and I ensure that patients and their families are well informed about their condition, treatment options, and available support services. I facilitate open and honest discussions about their wishes and preferences for care, honoring their decisions and preferences. Collaboration with the multidisciplinary healthcare team is also vital in end-of-life care. I work closely with nurses, physicians, social workers, and other healthcare professionals to coordinate care, address any changes in the patient's condition, and ensure that the patient's physical, emotional, and spiritual needs are met. Ultimately, my goal as a healthcare support worker in end-of-life care is to provide compassionate, holistic care that enhances the quality of life for patients and supports them and their families through the end-of-life journey. 47. How do you ensure effective handovers between shifts? Ensuring effective handovers between shifts is crucial for maintaining continuity of care and patient safety. To achieve this, I prioritize clear and concise communication during handover sessions. This involves providing thorough updates on each patient's condition, treatment plan, and any changes or incidents that occurred during my shift. I ensure that all relevant information, such as vital signs, medication administration, and any specific patient needs or preferences, is accurately documented and communicated to the incoming healthcare team. Additionally, I encourage open dialogue and collaboration between team members, fostering a supportive environment where questions can be asked and clarification sought if needed. By facilitating effective handovers, I contribute to seamless transitions between shifts, promoting quality patient care, and ensuring that the next healthcare team is well informed and prepared to continue providing optimal care. 48. Describe a time when you had to advocate for a patient's needs. I recall a situation where I had to advocate for a patient's needs during a particularly busy shift in the hospital. One of my patients, an elderly gentleman, was scheduled for discharge that day, but I noticed that he seemed apprehensive and unsure about going home. Upon further discussion, he expressed concerns about his ability to manage his medications and perform daily tasks independently at home, especially since his family lived out of town and couldn't provide immediate support. Recognizing the importance of addressing his concerns to ensure a safe transition home, I advocated on his behalf by discussing his situation with the nursing team and the attending physician. I highlighted the patient's concerns and emphasized the need for additional support and resources to facilitate his transition home safely. Together with the healthcare team, we arranged for a home health nurse to visit the patient regularly to assist with medication management and provide support with daily living activities. We also coordinated with social services to explore community resources and support networks that could provide ongoing assistance to the patient after discharge. By advocating for the patient's needs and collaborating with the healthcare team to address his concerns, we were able to ensure a smooth and safe transition home for the patient, alleviating his anxieties and promoting his well-being. 49. How do you approach learning new skills or procedures in the workplace? When it comes to learning new skills or procedures in the workplace, I adopt a proactive and adaptable approach. Firstly, I prioritize staying open-minded and enthusiastic about acquiring new knowledge, recognizing that continuous learning is essential for professional growth and providing quality care to patients. I actively seek out opportunities to expand my skill set, whether through formal training sessions, online courses, or hands-on experiences. I take ownership of my learning journey by setting clear goals and objectives, breaking down complex tasks into manageable steps, and seeking feedback from experienced colleagues or supervisors. Additionally, I embrace challenges as opportunities for growth and view mistakes as valuable learning experiences. By remaining flexible and resilient, I can quickly adapt to changes in procedures or protocols, ensuring that I can effectively contribute to the team and deliver the best possible care to patients. 50. Why do you believe you are a good fit for this role within the NHS? I believe I am a good fit for this role within the NHS due to my combination of skills, experiences, and personal qualities that align with the organization's values and mission. Firstly, my background in healthcare support work has equipped me with the necessary knowledge and expertise to provide high-quality care to patients. I have experience assisting with patient assessments, addressing emergency situations, and supporting patients with various medical needs, demonstrating my ability to thrive in a fast-paced healthcare environment. Moreover, I am deeply committed to patient-centered care and promoting the well-being of others, which resonates with the core values of the NHS. I prioritize empathy, compassion, and professionalism in all aspects of my work, striving to create a supportive and respectful environment for patients and colleagues alike. Furthermore, I am adaptable and quick to learn, which is essential in a dynamic healthcare setting like the NHS. I am eager to contribute positively to the team, collaborate with other healthcare professionals, and continually enhance my skills and knowledge to provide the best possible care to patients. 10 tips to pass healthcare support worker interview. Here are 10 tips to help you pass a healthcare support worker interview. 1. Research the role. Take the time to understand the responsibilities and expectations of a healthcare support worker within the NHS. Familiarize yourself with the organization's values, mission, and key priorities. 2. Review common questions. Prepare for the interview by reviewing common healthcare support worker interview questions, such as those related to patient care, communication skills, and teamwork. 3. Practice the STAR method. Practice answering questions using the STAR approach: situation, task, action, result to provide structured and detailed responses that highlight your skills and experiences. 4. Showcase relevant experience. Highlight any relevant experience you have in healthcare, such as previous roles, volunteer work, or relevant training. Use specific examples to demonstrate your abilities. 5. Emphasize communication skills. Effective communication is essential in healthcare support roles. Showcase your ability to communicate clearly and empathetically with patients, families, and colleagues. 6. Demonstrate empathy and compassion. Healthcare support workers play a crucial role in providing emotional support to patients. Demonstrate your empathy and compassion by sharing examples of how you have supported patients during challenging times. 7. Highlight teamwork skills. Collaboration is key in healthcare settings. Showcase your ability to work effectively as part of a multidisciplinary team, emphasizing your communication, teamwork, and problem-solving skills. 8. Address challenges positively. Be prepared to discuss how you handle challenges and difficult situations in a healthcare environment. Focus on your ability to remain calm, adapt to changing circumstances, and find solutions proactively. 9. Dress professionally. Dress appropriately for the interview, opting for professional attire that reflects your respect for the role and the organization. 10. Ask questions. Take the opportunity to ask questions during the interview to demonstrate your interest in the role and the organization. This can also help you gain valuable insights into the workplace culture and expectations. By following these tips and adequately preparing for your healthcare support worker interview, you can increase your chances of success and impress the interviewers with your skills and suitability for the role. In conclusion, mastering the art of answering healthcare support worker interview questions using the STAR approach can significantly increase your chances of success. Remember, each question presents an opportunity to showcase your skills, experiences, and commitment to patient care. By following the STAR method, you can provide structured and compelling responses that highlight your ability to handle various situations effectively. As you continue your journey towards securing a role in the NHS as a healthcare support worker, keep practicing and refining your interview techniques. Confidence, preparation, and a genuine passion for helping others will undoubtedly set you apart. We hope this video has equipped you with the knowledge and confidence needed to excel in your upcoming interviews. Best of luck, and we look forward to hearing about your success stories in the healthcare field.